Hello everyone, I'm Dr. Trey Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. I have, of course, many designations, and I am a certified public health practitioner. I do have a lot of immense experience in not only teaching doctoral level students, but also teaching masters in public health and designing curricula in the level of the masters of public health program. And so a lot of the competencies also are ones that I have encountered. In addition to some of the requirements that are available within the United States medical license exam that is administered, and that is so central to medical curricula. So an attempt to try to find common ground and try to make sure that there's alignment between competencies which are within the medical curriculum and from within competencies which are within the public health curriculum may at first seem challenging. But from comparing curricula at multiple universities, brick and mortar universities, and many universities, there's definitely consensus on many different areas between medicine and public health. The approaches are, of course, slightly different. And so this is a struggle that I have had for years, considering that I've had to kind of switch between hats when I'm talking to public health colleagues versus medical colleagues. So anyway, so this is kind of a reflection of the the difference between the two perspectives. Um, but my attempt here in this talk for whoever will be listening is to try to bridge the gap, potential gap that there is between medicine and public health, and actually show that there is a lot more common ground than gaps. So let's get started here with the first competency, evidence-based approaches to public health. Definitely areas that there's uh, uh, places in the medical curriculum that there's room to provide these experiences early on. So arguably, I would say that students would be getting exposure to some of these foundational competencies. In fact, some of the epidemiological methods like incidence, prevalence, and sample size is a competency and is a principle that students will get almost with every disease principle. So, and every disease perspective, should I say. So, what I mean by that, when you're talking about cardiovascular disease, they will get the incidence and the prevalence. When you're talking about mental health disorders like anxiety, about 20% experiencing this, they will get all of these. They will additionally, from early on, be provided the tools to understand evidence-based practice. And so not only will they be having community level experiences, but also understanding how to collect data. Now, the plan is to provide further instruction in more detailed epidemiological study design at later times. This is an illustration of actually a sample implementation of some of the public health competencies implemented in a potential medical curriculum. And so going into quantitative and qualitative collection methods, these are something that is very much possible to integrate into the medical curriculum, and it already is very much. Going through this, interpreting results of data analysis for public health research and policy or practice, there are several experiences that are already planned for similar types of situations. The bottom line is there's room for providing these competencies. There's room, should I say, to provide experiences for competencies, so that then this would allow for easy sort of checking for any sort of transfer credits. And so I'm just going to then now, instead of going too much into aligning with medical curriculum, I will in some examples, in some cases when it comes to mind, but instead of too much going into that, I'm just going to be listing some of the specific public health competencies, because I think they're extremely important to keep in mind in and of itself. And so number 5 goes into comparing the organization, structure, and function of healthcare, public health, and regulatory systems across national and international settings. And this is really taking into account, sustainable development goals and a lot of the international perspective that really are strengths of Ross University already, and AUC, American University of Caribbean. International health systems must be apparent for comparison to be possible. And so this sort of perspective, I think, is the perspective that is already being introduced. We're making sure, actually, in the social determinants of health curriculum to provide a World Health Organization perspective. That I actually created an interactive recently, illustrating some of that. This then leads us to understanding, how structural bias, and these things are very important. Social inequities and racism undermine health and create challenges to achieving health equity at organizational, community, and systemic levels. And this is a very important point to make, because the social determinants of health, it is at the root of really focusing on and addressing upstream determinant factors. So factors that are affecting society. And students really are, from the development of some of the curricula, are already involved in producing some of this early on. So students should be able to discuss some of these things, like racism, the impact of health equity at multiple levels for a particular health problem. They should be able to discuss health disparities and differences among groups, and structures operating inequitably. And I think they would be getting some of this information through through the medical curricula, especially offered through the Caribbean schools. So moving onward to planning and management to promote health, assessing population needs, assets, and capacities that affect communities' health, apply awareness of cultural values and practices to the design, implementation, or critique of public health policies or programs, and design a population-based policy program, project, or intervention. So all of these things, and you know, to see that you have to prepare students in connecting concepts of culture to the assignment. So, for instance, cultural adaptation, tailoring, stakeholder involvement and planning, cultural humility, all of these are very important. So it could just be critique too. So then we get into the very important portions of policy, leadership, and communication. So with policy, MPH placed four competencies. And so those four competencies incorporate broader than analyzing a specific policy. So this incorporates, students being able to explain technical aspects of how policies are created and adopted, include legislative and regulatory roles. So this turns into really talking about understanding how, and the fortunate thing is that this is not very difficult to locate due to the fact that there's so much policy. And students should also consider how research or evaluation evidence and ethics influence the policymaking process. So all of this is, even just recognizing the importance of community involvement and buy-in. This is important. Um, So then we go into leadership, and that's principles of leadership and management, including creating a vision, empowering others, fostering collaboration, and guiding decision making. And then students need to know some ways to negotiate, mediate. So negotiation, mediation. And then finally, communication strategies. And I think this is a very important piece, like press release, oral presentation, journal articles, things like that. How is this being done? And we should be able to discern between like different types of media, different types of health literacy, and communicating public health content. So these are all of the competencies that are related to public health. Definitely, the policy leadership are areas that are important, and planning and management in specific systems. But then other places like evidence-based approaches in public health can be introduced very early on, and especially when trying to think about fusion of medical curricula, or any sort of curricula. This is the approach that is best implemented when also trying to create the early types of research type of curricula. Thank you for listening.